The Frailty Project is about working with people who are at risk of becoming unwell and at risk of frequent hospital admissions. It offers patients up to 10 pieces of technology to have and use in their own homes. The kind of technologies that we're offering are saturation monitors, pulse monitors, blood pressure monitors, lots and lots of options. The patient will have a kind of a range of these technologies according to their health problems and their needs. Patients or their carers and family will take measurements using these pieces of technology. That information is then taken back to a team of clinicians, a team of nurses, and they look for differences from what we would expect. If they pick up something concerning, then the clinician will contact the patient, contact the relatives, the carers, and see how the patient is. And then using that information, having discussions with the patient and the family, looking at the data, they'll make a decision as to how we need to progress with the care from there.
I was diagnosed with Parkinson's 8 years ago. It's my main long-term condition because there is no cure and the treatment only looks after the symptoms. I was experiencing a period of low blood pressure, normally in the morning, but it wasn't when I was standing up, and I realised this. And I thought it was my blood pressure that was making me feel ill, or my low blood pressure. And what it was, we worked out with the doctor, who I saw 6 months later at my normal appointment, that it was one of the tablets that I was taking. Now, had I been using the equipment that I've got now that would have Bluetoothed that information over to somebody that could monitor my blood pressure, they would have realised that it was dropping, and we could have worked out a plan to measure the blood pressure in conjunction with the tablets, and I would have been able to change my tablets 6 months earlier.
The Frailty Project is just one example of the technologies that we're working on to trial with our partners. Other technologies include devices which monitor falls risk. We are looking at how we can help patients with dementia to track where they are if they get lost. And we're also looking at sensors in the home, things like sensors on fridges, on televisions, on kettles, so that we can monitor general well-being, nutrition, those sorts of aspects. As well as the in-home and other technology that we have, we're particularly excited by the development of our intelligence centre, because this is where the data from all of those devices is collected centrally, and it's combined with information from health and social care organisations. And we can use that together with the newest predictive analytics to help to build a risk profile for our patients, so helping to find out which of them are likely to become unwell or to have a hospital admission or indeed a readmission, and then work with healthcare professionals in order to try and reduce the risk for that individual.